Hello everyone, I'm Eric Taub. I write about healthcare and digital technologies for the New York Times and some other publications as well. As you can see, this panel is called the Form Factor Equation. And with me today, to your left, my right, I have Sarah Wang, the CEO of BrainUp. Alodeep Sanyal, the CEO of LifePlus. Hello. And Artem Shapitsin, who's the CEO of HealB. They'll explain more about what their companies do as we speak, and I hope we can do this more of a sort of a give and take, not question and answer to each individual. One thing that struck me when I thought about the form factor is, you know, when we buy a vehicle, we're attracted to one make over another because of certain features it has, and we make a compromise, and in the end we buy one vehicle. Most of us don't buy 3 or 4. And it's the same thing if we buy a refrigerator. One may have great features, another one may have great features, but you only settle on one. And when we talk about the form factor and how we're going to sell products that go on one's body, we have a limited amount of space available. And so what I'd like to first ask all of you, and please chime in, is how you decided to create a product and put it where you decided to put it. Given the fact that you're not alone in doing this, you've got some major competitors vying for the same physical space. Sarah, would you like to take that?
Sure, yeah. So from the name of our company, BrainUp, we're a brain computer interface company. So I guess it's a little bit different from the other wearables because we started this company because we believe the human-computer interface will be the next interface after the smartphone area. So this is what it looks like, and you wear it on your forehead to detect your brain signal. So our product is for sleep, to help you get into sleep, but I think the future of brain-computer interface is more like, for example, mind typing and like brain-controlled other electronics. So that's why we started the company.
Well, how does it help you sleep, and how long do you wear it for?
So this one is hard. It's hard material designed. So it's for power nap during like daytime. It takes. We aim for 20 minutes. So for now, the clinical trial, it's 7 out of 10 people can get into light sleep stage in 20 minutes.
In a way that they couldn't without wearing the device?
Exactly.
Okay, and so they get in a light sleep, you said, for 20 minutes?
So the light sleep is the first stage, and
right.
From light sleep, it leads to middle stage and then deep sleep and REM stage. So it covers the whole sleep cycle. Yeah.
Okay.
And the idea is to customize solution for different users because it detects your current brain signal waves, and it gives you the AI technology gives you counter waves to help you to sleep. Yeah.
And Artem, you've got your company's HealB. You've got a device that tracks calories and hydration level and other indices as well. And I noticed when I went on the website that the product that I saw was big.
You're absolutely right.
Big, and I thought, I don't know if I want to wear that. What kind of thought went into making it that size?
Maybe it makes sense to start with the place where we wear our device right now. It is a wrist. From the beginning, our audience was very clear, and right now we have it. It's 35 plus years old person. And for this audience, the watch, the traditional form factor, is very usual. At first, regarding the size, every time, as you told at the beginning of our discussion, we have to find a compromise between functionality and requirements to this functionality, and also available components. In our situation, the biggest challenge to the form factor is needs to be every time on the hand. Because we are measuring the digestion process, digestion process lasting every time. So our body working every time. And we need to be on the body every time. And in this case, we have to have a lot of sensors inside. At the same time, battery life, it gives us a big size. But right now, I'm proud to announce a new generation. The third generation of my hand is much more smaller, is much more comfortable.
So I guess you got feedback saying we need something smaller.
Yeah, exactly. It's a first feedback.
And how were you able to get it smaller?
It's a long way because from one side we did a lot of development regarding the hardware. Also, we made a lot of decisions regarding the where we have to place calculation. Because as I told, the digestion process is lasting every time. We need to calculate every time, and we have a very difficult solution where we have to place calculation on the band, on the application, on the cloud. It also gives requirements to the size of device. So mostly is hardware work to develop the more smaller PCB, also to find right components to make it smaller, and also the decision regarding the calculation is on the band, on the application, or on the cloud.
Okay, so and I think when we speak about, as I mentioned, when we speak about form factor, we're also talking about features as well, as far as I'm concerned. So one thing your device does, as I just mentioned, is it tracks caloric intake, is that right? So when I first saw that, I thought, well, we hear so much about the fact that it's not just calories, it's the type of food you eat. 100 calories of a candy bar is not the same as 100 calories of a piece of chicken. So why do I want to just track calories? That's my first question to you. And secondly, I noticed that it takes 7 to 10 hours sometimes to find out. So by that time, that I find 10 hours after I eat, I found out I ate too much. It's a little late, isn't it?
You're absolutely right. I guess it's the first question is the size. The second question mostly is why I don't see the result right now. I just ate my burger or whatever.
And why that's valuable.
Yes, but the reply is also very simple. Because our algorithms and our product works on the specific body, with a specific digestion process, with a specific metabolism, which also different regarding the sleep time, stress level, physical activity. And our body can't digest in one time, in 1 second, in 1 minute. So we need time to calculate what happened in your body. From one side, it's a very big opportunity because it's the biggest market to be more conscious, to change your habits in the meal, for the medicine. But another one, it's a very clear issue because everybody would like to have results right now. And the solution right in this period of time, I can't reply you, we have the solution. We are looking for the different types of application, also collaboration with companies like LifePlus. So we need partners who can help us to make consumer experience with our device and with another products more holistic.
So right now, so when I do find out I consumed X number of calories, do you also then advise the user what to do about that, or is that up to them to figure it out?
Unfortunately, right now, we don't have a recommendation inside our application, inside our product. It's the biggest reason to us to find a partner who already have the nutrition program, the recommendation system, because simply speaking, it is a two different products. One product is the measurements, another product is recommendation, third product is how we can change, we can help to change life of our consumer. It's 3 different products. And right now we have only one, is the measurements. And we are looking for the partners who can help us to develop the holistic product.
And you know, and that begs the question of the big, you know, the elephant in the room, which is Apple, with the Apple Watch, that's trying to bring all sorts of measuring devices. I remember that Tim Cook was testing glucose monitoring, which is what you do, Alodeep. So how are you going to compete with the one product that everybody knows about?
Thank you, Eric, and hello, good morning, everyone. So just to give a little background for the audience, what we do, we are LifePlus, based in Silicon Valley, where Apple also is headquartered, fortunately. And we have been there for 5 years, and what we are trying to do is trying to come up with a completely passive, continuous monitoring of major physiological parameters. Including the key one is blood glucose, as you mentioned, also blood pressure without cough, and heart rate, respiration rate, and oxygen saturation. And all these parameters are getting measured continuously without the user having any involvement. So from our product positioning point of view, we think that what is missing today in the preventative healthcare industry is that people don't have any way of continuously tracking their physiological state. And the primary home use devices like finger stick glucometer or a cup-based blood pressure monitor are way too cumbersome for people to use in a frequent manner. And as a result, there is hardly any data point today. So to obviate that, we first want to introduce maybe a little earlier than clinical stage, but fully passive continuous monitoring solution that gives timely alerts to the users, and then the user can take it to the next level confirmation using the primary home usage devices like finger stick glucometer or blood pressure monitor, and then take it to the doctor. The second important thing is today, in between two successive office visits, doctors have no clue how the physiological state varied over, let's say, last 3 months for a patient. But with our kind of product, and we are not the only one, I think that in next 10 years, this is going to be the face of the preventative healthcare industry. A lot of companies, a lot of products will be addressing it in different ways, different features. But bottom line is that the doctor will be presented a snapshot or a summary of the physiological state for the last 3 months, or whatever the number of months is between the two successive visits. That's an enormous benefit, because today the doctor orders multiple tests to even get the first level understanding how the patient is now. But with all this data continuously collected, summarized, analyzed, presented to the dashboard of the doctor, is a game changer. And that's exactly what's going to happen, I believe, very strongly believe, in the next 10 years. Now, coming to the question of glucose monitoring and Apple, first of all, I really don't know whether Apple has been doing research on glucose monitoring or not, because we see news and then the news goes away for many years. But it's a fact that we have been quite actively working on it, and we noticed that when you try to obviate the need of finger stick or touching the blood anyway, let's say in our case we try to do it optically, it's a very complex problem. There are multitudes of factors of variability, and you can be thrown off very easily. So we have been addressing the problem using several different contexts within the means of the form factor that we have been coming up with, which is a smartwatch. By the way, this is the prototype that I have been wearing, and you can visit our booth, the Hall D 45945, to see a demo. Now, the point is, what we see, and we are also taking consultation with FDA, that how FDA is looking into this matter. Because, Eric, if you look at the progress of the wearable industry as such, it started from mainly focusing on fitness, from step count, and maybe calories as well, and then one physiological parameter like heart rate. But when you get to the level of blood glucose or blood pressure, then FDA becomes more conscious about the product, that it can be used by the diabetics to mistakenly measure their the intervention, which is the insulin dose or anything like that, and then it can create a problem. So proper labeling of the product when we introduce is important. I happened to get a chance to talk to one of the directors of FDA recently in another meeting, and he gave a guideline that they're very conscious of the fact that today the glucose monitoring as such is a very complex problem for individuals because of sticking and all those things. So they are very supportive of the fact that companies have been trying to come up with completely non-invasive glucose monitoring, but it has to be in baby steps. So you first come up with a product, introduce, get market response, then slowly raise the bar on the therapeutic.
So you're
use
speaking
case.
though, when you talk about what your device does or you hope it will do, you're speaking conditionally. I want to clarify that, have you solved the problem yet of glucose monitoring?
Yeah, so that's a very good
Non-invasive?
question. Our current data on the early population shows that we are about 15-20% off from the finger stick, which may not be classified as an FDA clinical grade home use device right now. But there are many problems, including the commercial sensor that we are using. That's not optimized for glucose measurement. So on a second project, we have been developing our own sensor as well.
Okay.
And we have been heavily
So you're still
patenting.
in the development.
Still in the development, but we want to release one product which will at least get a sense of the market, how market perceives this kind of product. That's what we are trying to do by releasing the first product by the end of this year in a specific geography where it suits, and purely on a consumer market.
Okay. You spoke about all the data that you'll be able, and I'm sure all of you are in a position where your products will be able to collect a lot of data. Recently, I got a Ring doorbell, which I thought was great, and I'm not home, and I find out that somebody's knocked on the door, or Amazon left a package, which was great until one day last month when I was in India, and I got an alert at 3 o'clock in the morning that the gardener was walking by the front door. And I thought, this is driving me crazy. You can have too much information. And what I'm wondering about is with these continual monitoring devices, whether it's your products, an Apple Watch or an Omron watch or Withings or whomever. And I'd like your thoughts about this as well, Sarah. Are we doing too much monitoring? Are we making people crazy by constantly looking at bodily indices when we've been perfectly fine, never knowing what's going on half the time? What do you think?
I think from the business or development point of view, the devices that will be left will be ones that people will need the data.
Do we need a device to be able to take a nap?
I think a lot of people do have that problem, especially in the business world. And a lot of people, I read from 2019 the data, like the depressed people, and a lot of pressured people are getting more and more. And I think that will definitely help with that group of people to get more sleep, to get more rest. And there is definitely a huge market out there. But for those, that's not a problem. I think they won't buy the device, and I think that's totally fine.
Yeah.
So I wouldn't think too much data is a problem. As time goes, all the useless devices will be just left out.
Okay.
And so I wanted to chime in this topic, and I totally agree with you, Eric, that sometimes too much data is really an annoyance, because I was perfectly fine without knowing all this. Now I am getting bombarded with so much data. So I personally think the way the market will evolve, and we are all early takers of these kind of products, is that first of all, there is a specific segment that has a therapeutic need, as Sarah was pointing out. They will anyway adopt it first. But then for the larger population, which is the common users, we first probably need to come up not only with the product platform from technology point of view, but also an ecosystem supporting it. Meaning that just in the simple sense, a call center or a support center that can respond to your basic queries and basic surprises. And we need to tee down these alerts as much as we can. And that's exactly where the AI will play its own role. Because AI over time will learn that what patterns are purely normal, there's no need to raise even an eyebrow, and they will just suppress those messages over time. So in the next 5 to 10 years, AI will evolve and learn the specific data sets and patterns, and it will only start giving the messages or alerts when it's really important or necessary. That's
So
how
that
it will
you'll be able to cut down on
Absolutely.
actually telling you.
Absolutely.
I think I totally agree with my colleagues regarding the data, and everybody would like to have the data. But if you look to the consumer perspective, nobody wants our devices, and nobody wants our data. Everybody would like to change something, because when we buy our device, it doesn't matter. He will be whatever, Apple and whatever. the main idea is to change something. And our big challenge, for my opinion, is just my opinion, what we have to do, we have to collect all data and pack it into the very simple solution. We see it right now in our consumer as well, because we have maybe biggest issue that we have a lot of data, but without packaging,
Right.
it's nothing, zero.
Right. So having data with no analysis is useless.
And right now we have a very, very funny situation on the market because everybody talking about we need the data. Everybody we need data, big data, artificial intelligence, and but in the reality, if we look to our own life, we don't have time and interest to look how it getting artificial intelligence or whatever. We don't interested to look in this dashboard of different parameters. We just would like to understand, okay, can I eat this pancake or not? Do I have to go to the gym right now or maybe later? Maybe right now makes sense not go to the power workout, but maybe it makes sense to use stretching or yoga or whatever. I guess I totally agree with the discussion regarding the glucose curve. It's also very close to the big idea that everybody needs a big data. And nobody can solve the issue with glucose. Because the traditional tools, medicine tools, don't solve this issue. We just have a piece of this solution, and the big challenge to combine it in very simple.
I just quickly wanted to take a 30-second kind of discussion on your previous question to him, that the results are available so many hours later. What's use of it, right, on the calories? So I think I wanted to chime in on that because I think we have a very cool application on that. So first of all, Artem mentioned about partnering. This is exactly what we should do, the early players.
Absolutely.
We are doing glucose, you are doing calorie and hydration, and even if the data is, the results are available many hours later, but it has a tremendous value retrospectively. So let's say you start wearing a system which has a combination of the calorie and the hydration measurement and glucose.
And sleep also.
Right, and then start bringing Sarah's
And then
I'll be the matchmaker here. You'll
and then basically you basically use it for, let's say, first few months, and that is the time when the system is learning your body, and then it will start giving you the important, meaningful insights about your sleep pattern or your meal intake, or in general how this impact your physiological well-being.
Okay.
So even if the data is initially delayed, but the value is that's the time the system is learning. So
Okay.
it's basically the learning process.
Well, I'm sorry to throw a spanner in the works here, but you may know about this recent Apple study where they helped people find out if they had potential atrial
Yeah, the
fibrillation.
heart study.
And
Stanford.
then 80% of the people who were told they did nothing about it. So how do you make sure that the people who use your product and get various information about something they should take care of actually make the effort to do something?
Absolutely. Our product is a bit different. We have the intervention function. So it's not only monitoring and giving reports of data, sleep reports, all of that, but also to help people to get into sleep. I think that is very important for every wearable. The second step, after monitoring the data, you can actually help your user if that data is not in the right or normal range. I think that's very important for every single wearable. Yeah.
Yeah, I totally agree with you. Yeah, that's exactly how this will pan out.
Okay. We've got just a few minutes. We'd be happy to take questions. If anyone has one, please wait for the microphone. And does anyone have one? No questions. Okay. One hand is up. Oh, two. Okay.
You kind of touched on it at the end, the last question there, but the whole track is behavioral modification. from your perspectives and your backgrounds, what do you think are, maybe each of you, the top thing that's going to change behaviors from the stuff you're working on?
I can reply if we can show the very simple connection between, for example, weight loss process or calorie intake or hydration during the day and the feelings of our consumer is the biggest step to have motivation. I can see right now it's very difficult to us for our stage of development as well. But if we can show this connection, it is a big step.
So, totally following Artem's point. So, this kind of system has a seeing and believing kind of an approach. That you start following the insights that are coming from the cloud, from the AI, and then you follow those steps, and you see that you are more within the normal ranges of the parameters, or your calorie intake and calorie usage is more consistent, and you are losing weight. So it's kind of a seeing and believing.
Honestly speaking, just maybe one comment. Sorry, what we can do is just a mirror. So we could just show the mirror with like you wear something and you look how it looks like. It's the same with the body. I guess it's only one way. Sorry.
So for us, this sleep product is only one of our products, but we really believe brain computer interface that would actually change people's behavior in the future. Our team, I myself graduated from Harvard, and all the team members are from like Stanford and all the really advanced technology backgrounds. So, I mean, in terms of like mind typing and all that fields, we also focus a lot on that. So we believe brain computer, it's definitely a huge thing.
I think we have time for just one more question, and a woman back there has had her hand up.
In the terms of glucose monitoring, you never really spoke about CGMs, which are not totally invasive because they don't interact with the patient's blood, but mildly invasive in that there's a sensor that goes underneath the skin. Do you think the solution for glucose monitoring is some intermediate between non-invasive and typical pricking of the finger, or do you think non-invasive will reach like the accuracy required to actually send users this data?
That's a great question. So I think the CGMs that we see today, they are minimally invasive product, and the sensor goes a little deeper inside your skin, and you have to replace it every 14 days. But the one major disadvantage of that is that the numbers that you see at any given instant is a little delayed number. So it's not a real-time reporting of your blood glucose. It's about 5 to 10 to 15 minute delay based on the product that you are using. So our product, and not the current one with the commercially available sensor, but as I was alluding to that, we have been developing our own sensor, which is way more complex than what's available in the market right now. That, we strongly believe will actually take the accuracy at least at the level of the CGMs, or probably even better, because ours would be reporting real-time numbers, not delayed.
I'm sorry, we are out of time, so I want to thank all the panelists for their very interesting information. Thank you.
Thank you so much.
Thank you.
Thank you very much.
Thank you, Eric.